My name is Dr. Vikki G. for George Hufnagel, MD. I've been asked to testify by DoIt.News as to the events that happened in 1995 when I asked for a hearing before the Medical Device Committee of the FDA in Maryland. This is 1995. I am making this testimony under penalty of perjury by the laws of the state of California where I reside, and also by federal law. All statements that I'm making in this recording are statements that I am making under penalty of perjury, and thus this is a legal document, and it is my belief it's the first audio legal testimony to be provided using media. So thank you, DoIt.News, for giving me this first-time opportunity. Background. I am a trained OB/GYN. My schooling included attending the University of California, Berkeley, where I was very active and helped create the first woman's free clinic in the nation. Wrote chapters for the books Our Bodies, Ourselves, and worked to be a member of the Berkeley Women's Health Collective at that time. I attended UC Davis, where I was recruited. Dr. Lindsay Kumagai recruited me to become a doctor because he felt that my work in women's medicine as a college student was exemplary. My mentor at the time was at Berkeley was Dr. Alan Steinbach. I then went on from UC Davis because I decided that I wanted to be a surgeon, and I went to UC San Francisco Medical Center in order to train to become a surgeon. My major areas of training were in neurological surgery and cardiac surgery. I had an event during my training there that I nearly died from a misdiagnosed disease in which my gallbladder was rupturing, and Dr. Larry, or known as Larry, but he's also known as Dr. Lawrence Way, saved my life. I continued as the only female in my class to go through what is called a surgical pathway. Women at that time were not encouraged to be surgeons. I finished the surgical pathway and met with Dr. Way, and he said that my skills were excellent, above average, and that I should think about, because of my background in women's health, becoming a gynecologist. He then went on to comment that gynecologists were not the best surgeons. They didn't have the best skills, and he felt it was the area that I could more than likely provide change to because of my training and natural skills that I had. So I went on to become a gynecologist. I went to Cedars-Sinai Medical Center, and then when an opportunity became open at Albert Einstein College of Medicine as a fellow in oncological surgery, that is someone who does surgery for cancer in women, I took that fellowship and became the fellow at Albert Einstein College of Medicine in oncology. While I was there, I was asked by the Department of Surgery if I would like to join their department as well and learn to become a surgeon for the breast, because I had given several lectures on the fact that it made no sense to be a gynecologist taking care of women and not know anything about the breast. I became the first resident at Albert Einstein College in obstetrics and gynecology to be trained in breast surgery as well. I then returned to Los Angeles and back to Cedars-Sinai Medical Center, where I was the only gynecologist who had breast surgery as well as gynecological surgery privileges. I've always been a student of science, and of medicine and history. I then continued to study and have multiple MD degrees in other areas of medicine and multiple graduate studies. Those graduate studies that are important include philosophy, in which I became the nation's first bioethics surgeon. I wrote law, and that law is informed consent law for hysterectomy for the states of New York, Texas, and California. My speaking out and skills ended up in me being attacked for basically trying to educate women on the truth of science and medicine and how it affected their health and their bodies. Therefore, my testimony that I'm giving today is not the testimony of an emotional female. It is the testimony of a studied student and historian. In my practice of medicine, I saw the many abuses and crimes, yes, I say the word crimes, taking place, and I elected to put 1/3 of my income into creating an institution that would help these issues because no one was fighting for them. I began the Institute for Reproductive Health. I was looking at all the issues that were affecting the reproductive organs of women, from the breast to the clitoris to the uterus, the fallopian tube, etc. And I spent my time and money supporting these issues. In 1995, I asked for a hearing at the FDA in Maryland. And I'm going to go through that hearing in 3 sections so that the listener and audience can have areas to think about, because I was doing a very complex hearing at the FDA Device Committee hearing. First area is morcellation. Second area will be Ovabloc, Essure, and Tubal sterilization. And the third area was on breast implants, breast surgery, and breast cancer in women. A generalized area was that of the general health of women and the relationship with female hormones. I spoke about the relationship of female hormones in each section that I presented. I was not knowledgeable and not politically astute at that time. I was a young physician on television and supported by Oprah and many others, and I had not been attacked fully at that time. I was under hearings to take my medical license, but I was not really educated in the politics of financial aspects of medicine and the organizations that controlled them, which included organizations such as the American College of Obstetrics and Gynecology, known as the ACOG, the American Medical Association, and even the FDA. Most controlling aspect was the California Medical Board and state medical boards and how they interacted with the institutes of power, which are the medical boards in specific areas such as American College of OBGYN. That is a whole other declaration that I will be making, but I want to make it very clear, in 1995, I did not know how these institutions work together to stop exposure of abuses and crimes. Today, having been attacked for more than 20 years, I am well aware of how the system works. Morcellation. I was a member of the American Society for Gynecological Laparoscopists. I went to Germany to work with the top surgical trainer in laparoscopic surgery in Germany. His name is Dr. Kurt Sim, and he has passed away. he was well known for his teaching, his skills, and he was internationally considered the world's expert. Certainly I felt he was, listening to his lectures, watching him operate, and I went to Kiel, Germany to study under him. I learned how to remove fibroid tumors through a laparoscope. My first patient, which I will be writing on and presenting as well, had a small necrotic fibroid. She had had an infarction. The blood supply to the fibroid had cut off, and she was having severe pelvic pain. The fibroid was located on the cornea of the uterus. And on the cornea of the uterus, this goes into where the fallopian tube is. The tumor itself, by becoming infected and becoming degraded as a tissue, that tumor could destroy that fallopian tube. So I knew that that fallopian tube needed to be saved. I did preoperative laparoscope on patients in order to know what their actual diagnosis and findings were, which is a mandatory issue in medical science, is to do a pre-op evaluation. And I made protocols that I wrote out for my pre-op evaluations for every issue so that I would not miss anything. My study of aerospace medicine and what physicians were doing at NASA helped me use a military form of thinking as used in space travel for creating protocols. I have been the only physician to create these protocols in all of these many years that have passed. However, the protocols do work, and they do prevent problems and complications in many ways. I removed the tumor. The patient went home the same day. She went on to have a normal birth and have a female child. The California Medical Board filed charges against me for fraud and criminal actions. They stated that no one could remove a fibroid through a laparoscope, and thus began to attack me. I removed the fibroid through a laparoscope. I did not chop up the fibroid and spread the fibroid tissue throughout the pelvic cavity because I was trained as a gynecological oncologist and knew that that would be harmful. I was never paid for that surgery, and I was condemned for that surgery. At all times, the California Medical Board, the American College of OBGYN, knew that a path report confirmed that the tumor had been removed at the time of surgery, and that I had not made up an operative note and billed for a tumor removal that was a lie. I had not committed fraud. But today, still, in all the medical records, the California Medical Board, ACOG, created documents to try and convince everyone that I had done a criminal act, which I never did. Lawrence White, the head of the California Medical Association, went on radio, went on everything to explain that I was a fraud and a terrible doctor and I needed to be burned at the stake. My patient has no idea all the problems that I suffered for saving her uterus and allowing her to have the baby girl that she now is a young woman, graduated from college, and working hard to make social change. I will be writing this surgery in detail. Why am I telling you all this? I'm telling you all this because you see, I was advancing in laparoscopic surgery at a very fast rate. I went to Kurt Sim and studied whenever he was here in the U.S. as well to become the best I could be. I knew that diseases existed that needed to be diagnosed through the laparoscope, and I needed equipment to do that. I approached the Storz Company because I had done a study with Dr. Marilyn August, and the study was on a syndrome that I have published on and peer-reviewed on called red uterine syndrome. When physicians in gynecology do a laparoscope, they were not looking at the color of the uterus specifically, and they were not seeing that there were these very, very red uteri. The uterus, the fallopian tube, all very bright red. I created a surgical brush system to brush the uterus and brush the fallopian tube and gather cells from them and take them to the lab. Dr. Marilyn August and I became friends. She was a microbiologist and head the microbiology division of Cedars-Sinai Medical Center at the time. I had learned about chlamydia, mycoplasma, and ureaplasma in my studies at the University of California, San Francisco as a graduate student. I cultured out chlamydia from the pelvis and showed that many times the physicians were having a woman come in with pelvic pain and missing the diagnosis because they didn't recognize the color change of the uterus, and they did not even think about mycoplasma, ureaplasma, or chlamydia causing these infections, which required special culturing. I presented that paper, and it was peer-reviewed and well accepted by especially the European community. I showed that you could culture and make the diagnosis and then give the proper treatment. In doing that procedure, and I learned that I needed other instruments. I was doing many operations because I broke away from the training of obstetrics and gynecology in the United States and studied the work of Dr. Victor Bonney in England. All of our textbooks were focused on the work of Dr. Novak in the United States, who procedurally looked at every disease or problem in the female body, and his answer was, cut it out. If you had something wrong with the fallopian tube, remove it. If something wrong with the uterus like a fibroid, remove it. Novak's procedures were to remove organs for any disease processes across the board. You had a cyst on the ovary, remove the ovary. Scientifically, this was illogical. Ethically, in my study of bioethics, this was unethical. Thus, when I read the papers and books and learned about Dr. Victor Bonney, I studied as a scientist, a historian, and a philosopher. What I learned to do was then focus my work on saving the female organs. And I developed a new field of medicine called female reconstructive surgery. Everything I did was focused on saving women's organs and not doing unnecessary surgery. This was all actually escalated by the fact that in doing my research, I called the National Institute of Health, and I was trying to get data on organ removal in women and cesarean section. How many cesarean sections are done a year? How many hysterectomies are done a year? How many oophorectomies are done a year? I learned that there was a division of the National Institute of Health called the Statistics Division, and I spoke with them, and that began a 4-year time period in which I did work without pay in order to gather the data on hysterectomies. That data was published after 6 months of review by the NIH divisions, and found that the data was completely accurate and showed that only 4% of the hysterectomies in the United States were done with indication. 4%. Thus began an additional battle against me, because I was taking away the bread and butter operation in gynecology and showing that the ACOG knew better and was still doing these operations, knowing that many of them were unnecessary. That became a federal document, and I wrote the book, No More Hysterectomies. And that began further attacks on my life, with life threats, and on my academic medical career and my clinical medical career. So what then happened was, I knew that I needed to know, was there adenomyosis in the uterus, leiomyosis in the uterus, fibroids in the uterus, sarcoma in a fibroid in the uterus, and different forms of endometriosis in the pelvic cavity, and I needed instruments. I designed the instruments, went to Storts, and asked them to help me. The answer was no. You are a female surgeon. You're too young. You're not a senior surgeon at Cedars Sinai Medical Center, and we do not work with junior surgeons. Also, we can't do it because we're about to bring on the most revolutionary surgical device on earth. This revolutionary surgical device on earth will allow every surgeon in gynecology to go in, remove an ovary, remove the uterus, remove anything in the pelvis through a laparoscope. That is when I first heard about morcellation. I heard about morcellation by attempting to get devices that I needed to save women's organs with. I wrote letters, I made calls, I did everything I could do. And what I had to actually resort to was gymming and creating things in the OR that I could use, because Storts would not assist me, because they had the new miracle device, which they only wanted to spend all their time and money on, and because of the difference that I was not a nail surgeon, they made that very clear, and because I was not a senior surgeon. Thus, I have knowledge of what was occurring politically and financially at this time. I also, though, because of Oprah, my book, No More Hysterectomies, and my surgical outcomes, had the largest surgical group of patients in my area. I did more surgery than any other gynecologist. I had the lowest complication rate, and I was doing the most complex surgeries. That created jealousy from my local peers, and hatred, and the need to burn me at the stake. I do not have a warm and fuzzy behavior. I am not sweet with women. I'm compassionate and caring, but I do not accept bad behavior in anyone, and illogical or hysterical behavior. So I am not a Mother Teresa. Women who came to me were from the black community, black females who knew that they could trust me because I was working with Senator Diane Watson, who later became Congresswoman Diane Watson, to write laws to protect women and to expose medical abuses in the black community. The black community trusted me because I had shown by my work that I was not going to abuse them, and not only not abuse them, but I was going to stand up for them. The other group of women were educated women, women who had advanced degrees, like my patient whose husband was a Nobel laureate in physics, and she was a professor and probably still is on staff at Caltech. And she came to me because I was scientifically oriented. Her Nobel laureate husband reviewed all my work and told her that she must go to me as the surgeon. So I only had two major populations: highly educated, science-oriented, poor black women who have been abused and were not going to take it anymore. Another story to tell you all at another time. So now I don't have the instruments. I jimmy instruments and try to and make them so they work for the initial laparoscopy. I know that leiomyoma sarcoma occurs in women. I'm an oncologist. This is something that every gynecologist, even boondock gynecologists out in the country, have to know. They know that 1 to 2% of all fibroid tumors will be a sarcoma. And the language being used in current documents and journals is the unexpected sarcoma. There is no unexpected sarcoma. There is always suspected sarcoma when you go in to do a surgery on the pelvis of a woman. Always. So this language that has been created is a cover-up language taking place in America today to say, oh, the poor doctors, they didn't know there was a sarcoma. The diagnosis of sarcoma, like adenomyosis, is a tissue diagnosis. You know when you start an operation that these are the different things you could find. You could find a fibroid tumor benign. You could find adenomyosis, adenomyoma, leiomytosis. You can find a sarcoma. These are not unexpected. And I'm very offended by the manipulative manner in which papers and documents are being sent all over the world to say unexpected sarcoma. There is never an unexpected sarcoma. When you open up, go in, even with minimally invasive surgery technology, you are always suspecting sarcoma. Always. So that language that is being used is a cover-up, is a fraud, and takes away informed consent of the patient. The capsule of the sarcoma is extremely important. Women can die with sarcoma. They can have a sarcoma in a fibroid tumor, live their life and die and never know it, and no pathology report is ever done, no autopsy to tell them they had the sarcoma. The capsule of the fibroid, having done thousands of these operations, not 1,000, not 3,000, over 5,000, in my short career. Remember, my career was cut short in order to stop me from these advances and explaining about the advances and telling women, because saving one woman is not enough. Educating all the women is the proper way. The capsule of the sarcoma keeps the sarcoma from spreading. And I removed sarcomas and saved uteri in many women. Because you see, I always suspected sarcoma, and part of the 30-page, I want everyone to hear that, 30-page informed consent that I gave on surgery for women explained, if we go in and we find a tumor and we hand it to the pathologist, the frozen section may not be accurate, so we have to wait 3 days. The informed consent said, if your fibroid tumor is a sarcoma and returns as a sarcoma, you must then see a gynecological oncologist immediately, undergo the treatment that they suggest, which at that time was hysterectomy, and follow their treatment program, because sarcoma is an aggressive tumor and it can take over the body, and I had seen it. And I will explain that case as well in this testimony. Every case that I had removed a sarcoma and its capsule and took wide edge cuttings, because I had to suspect that every tumor I removed was a sarcoma. Not unexpected. That is just fraud, and I'm extremely upset over that. I submitted to pathology, and in the informed consent, every woman I talked to before I operated on, I said, if it comes back a sarcoma, you're likely going to have an immediate hysterectomy, but you will survive. Because that sarcoma had not broken through its membrane and had not spread to other organs. I sent many patients to Dr. Dan Smith, one of my mentors, a gynecological oncologist, who was then the chairman of gynecological oncology at Columbia Presbyterian Hospital. It was found that there was no sarcoma left in the uterus from my female reconstructive surgery. That was because at all times I knew and suspected sarcoma in fibroid tumors, because that is science. It's also ethics. I had one patient who died from her sarcoma that had nothing to do with me and my surgery. This patient came to me with a large pelvic mass, approximately the size of a regulation football, and with vast amounts of fluid in her pelvic cavity. She had known about my work, but was seeing an alternative medical doctor whose position was, all fibroids are benign. All fibroids are benign. That is not true. So she followed this patient for 10 years as the tumor got larger and larger. I explained to the patient that she was at the point of not being able to function. The tumor and fluid was too much, and a diagnosis needed to be made. I told her that it was very likely she had a sarcoma. She asked me not to do a hysterectomy. I told her I would make the diagnosis, but I would then refer her to Sloan Kettering or Columbia Presbyterian Hospital for follow-up, and that she would likely need all of her organs removed and further resections. I suspected the possibility of a sarcoma because that is what you have to suspect. The tumor had broken through its capsule, and there was necrotic tissue everywhere in the pelvic cavity. So that the tumor itself, the sarcoma itself, had now embedded and was everywhere. I did a thorough clean out. I sent her to a gynecological oncologist that I knew was very insistent on getting every cell that he could get. And I then sent her for review at Sloan Kettering. She decided that she could heal herself with her alternative doctor, having the mask on. Now her stomach was down and all the fluid was out, and she was going to go that route. She would not listen to me. That was fine. She gets to do what she wants to do. It's her life, her body. But I gave her all of the options and choices. She then went and told people that she was going to go get cured at a hospice. She had no idea what hospice means in this country today. Hospice means death in this country. It's not a place to go and get healed and be revived and have people, care for you to struggle and fight against a cancer. It's a condemning word. Another issue for another time to discuss. So this woman died because she kept being told, oh, it's a fibroid, don't worry. The other thing that physicians do commonly, which I wrote about many times and lectured about, is, oh, we'll watch your tumor. You cannot watch a tumor. You're not looking at it, touching it, biopsying it every day, taking blood samples to look for cancer. You can't watch a tumor. Their idea is that if you put an ultrasound or do a scan on someone, like a CAT scan, that you can tell whether it's cancer or not. You cannot tell it that way. It's one of the things that I condemned in looking at fibroid tumors, that everyone can simply watch a tumor. You can't watch a tumor. You can hope that it doesn't grow and it doesn't explode and go outside its capsule, and you can hope it's not a sarcoma because you got a 98% chance. But if you're the 2%, forget it. If you're the 2%, you cannot watch a tumor. I never watched tumors, and I tried to educate every female patient that there's no watching of tumors. In my study of sarcoma, which is of import, I learned that there's different types of sarcomas that affect the body in different ways in how they spread. The one case that I spoke about, the spread was through the capsule and became very rapid and progressive once the capsule broke. The capsule is the key. So in 1995, when they were pushing this machine that Storz wanted to bring out, which is like a mini Cuisinart, a chopper. That's what it is. It's a chopper. They put the chopper in the body and chopped up tissue in the body and sucked out what they could. They had no protocol before they did the surgery. No one was doing studies properly. They weren't doing a CA-125 on every patient. They weren't getting a family history. They weren't doing a genetic history. They weren't doing anything, and still today they're not. Still today, there is no protocol by the ACOG or the AMA or the FDA as to what you need to do to work up a patient. They don't have one. These government institutions and these so-called colleges of obstetrics and gynecology, colleges, are not providing adequate teaching, adequate rules and regulations. and they don't update their work. What they do is spend millions of dollars on cover-ups. And I will cover that also in my testimonies. The capsule being cut into or broken releases the sarcoma tissues, and they spread all over the pelvis. Gynecologists wanted this instrument for one reason. They could sell more surgery. Storts wanted it, and then as it passed down and as different versions became available, everybody wanted it because they could sell surgery by marketing and lying to women, which they are still doing today. Lies. Oh, we can go in and you only have 1 or 2 little incisions and you go home the next day and no problems. How in the hell did Harvard get away with this? Everybody get away with it. It's insanity. You can't chop up tissue in the pelvic cavity and spread it all around and think that you're not going to kill women. You're going to kill that 2% no matter what. By creating the device, you're going to kill that 2%. You know that going in. This is not unexpected, everyone. This is totally expected. My protocols were that capsules were removed in full. Irrigation in the operation was necessary with 4 to 6 liters. 4 to 6 liters at the time of surgery in order to reduce any cell count left behind. Morcellation, they had no protocol. Morcellation had no special irrigation protocol afterwards either. They knew going in and allowing this device, they were going to kill 2% of the women with fibroid tumors. That is not acceptable. That device was an error, and I testified to that in 1995. I explained that the device had to be outside the body cavity, that they had to redesign it, and that they had to have a means of removing the tissue in such a way that cells would not be spread, and that they had to rework everything. FDA knew this in 1995. Storts knew this in 1995. I published and lectured around the country against morcellation. It was not science. It was not ethical. It was about profit and using fear on women. The psychology was very simple. We tell the woman that she's going to have no real scarring. She's going to go home the next day. We sell the surgery. That is the whole purpose. Selling the surgery. Not looking at the risks and complications. At the recent FDA meeting on September 24th, I heard how robotic surgery is the great answer. It is not the great answer. That's another selling of surgery. You do not sell surgery. You educate the woman and give her her options and choices, and she makes them. You don't make her scared of having a laparotomy. Opening up the body and feeling the tissue and biopsying the tissue and making sure there's no spillage. Or if there's spillage, cleaning it up and doing your best and then referring her for a proper follow-up. Not sending her home to die. There is nothing in morcellation that is acceptable today. It wasn't acceptable to me in 1995. It's not acceptable today. All that has happened is a history of corruption, cover-up, and abuse of women. And more so now, psychological issues that have developed over this with women patients. Women patients beg and cry and ask for help from institutions like the ACOG and the FDA. These people know what they're doing when they do it. They are criminals. You don't go to a psychopathic, antisocial murderer and ask them to feel bad about their murders. You put them in jail. You make them pay for their malicious, intentional, having no reverence for others, no reverence for life. And you take them out of your society. You don't permit them to continue. Morcellation needs to end. Excuse me. Sarcoma itself needs funding and investigation so that we can have better outcomes when error has occurred. But we need to not have error, and one of the ways by not having error is to educate women and have protocols that prevent these horrific tragedies. Horrific. All I can say is that if you're seated with sarcoma, you need a great surgeon using an argon beam, irrigating as much as possible, and taking as many cells out immediately as they can. You need all organs that have been touched cleaned up or removed. You need your best radical surgery that can take place. But we should not have to go there, because there is no such thing as unexpected cancer, unexpected sarcoma. It is suspected at every case that you do, or you are not an ethical surgeon. You are not an ethical doctor. Bottom line. It doesn't take a great deal of intellect to know about science and use it properly. It takes discipline, organization, and not having greed and money and selling surgery as your primary goal. Before the FDA, they knew in 1995 that morcellation would kill. I am now requesting all of my documents and reminding everyone that Susan Wine, who lived in New York at the time and who was a volunteer for the Institute for Reproductive Health, was present at that hearing with me. She was volunteering to work on the education program for women. Mark Popp, who now resides in Germany, came to videotape and to attend the hearing because we were banned from videotaping the hearing. The FDA refused to allow us to tape it. That he can be contacted, so that there were 2 witnesses to the 3 areas that I covered and the area of hormones that I covered on these 3 areas. And they were live witnesses to this event. I'm going to ask the FDA to send me all my documents. I'm going to ask the FBI to proceed an investigation because this is beyond negligence. This is beyond negligence, and I suspect a thorough investigation will uncover many abuses as to morcellation. Morcellation needs to be stopped, period. The way it is, and redesign the machine, which could have been done in 1995. I even showed how to do it because I love engineering and I love the science of making equipment and things. It could have been done back then. I am going to be taking this tape and also sending it to as many people who know about my work and have no idea what happened to me and who need to know the history of this, and it needs to be documented to continue when I am no longer here. My institution needs to continue, and I'm asking that people donate funds and purchase our series on morcellation to support sarcoma research. We will be giving 50% from our institution on the educational package we are making on sarcoma to Amy Reed, to her husband Homan, to them to use for this much needed research. Sarcoma needs to be stopped. Also, morcellation needs to be stopped. It should not have gone on this many years. And as America wakes up and sees the data and sees how much harm, this will change if you each take action. What else can morcellation do? Well, let's go over it. What do you get in the uterus? You get fibroids, you get adenomyosis, you get endometriosis, you get infection, you get ovarian cancer, you get tubular cancer. What does morcellation do? Make more fibroids, make more adenomyosis, make more endometriosis, make more cancer. Cervical cancer could spread as well. You morcellate to take the uterus out. You chop it all up and the cervix has squamous cancer. You chop up an ovary and it has ovarian cancer. It is insane, not logical, and not science to use these techniques. And worse, is reflective of it, is that you will find no true protocols even for doing this. They don't care. They're selling surgery. Women don't need to lose their lives because they're made scared of having a laparotomy and having a scar on their belly. That is insane. Less is not always best. And that is what they're selling. They're selling less is best, and it is not. When you have a cancer, you want to know you have it, you want to remove it, and you want to know all your options for treatment. And I'm speaking as the fellow in gynecological oncology. And you certainly know that there were so many oncologists who knew about morcellation, and they didn't come up to bat for women. This is horrific. They should have been screaming, "Get this piece of shit equipment out of here. This is going to kill women." They didn't do it. There is a lack of ethics in medicine, and everyone is scared to speak out because when you do like I did, you are attacked, and they continue to attack you and attack you and attack you. No more morcellation is my closing words. No more morcellation. This tape can be used to educate women, to bring charges against those that are guilty. I'm willing to testify. I can't travel very well because of my disabilities and poor health, but I'm not going to give up the fight. Again, everything I've stated is the truth and nothing but the truth. So help me God. I'm ending this testimony on the 27th of September 2015 and submitting it to DoIt.News. Thank you.